Medicare is confusing on purpose. 4 parts, dozens of plans, hundreds of commercials, and somehow you're expected to figure it all out on your own. Hi, I'm Ron Ray with Turning 65 Solutions, and today I'm going to break down Medicare Parts A, B, C, and D simply, clearly, and without the insurance jargon so that you can actually understand what you're signing up for. Now, we've already covered Part A and Part B. We're going to skip Part C for now, and we're going to go directly to Part D. That's the important part with original Medicare. A and B is Medicare Part D. Medicare Part D, D for drug. Before we do that, a very quick review. We covered Medicare Part A. That is your hospital coverage. It covers essential services in the hospital. Also covers some skilled nursing care and hospice care. We talked about Medicare Part B. That's your outside the hospital insurance. It covers your office visits and all outpatient services, including preventative services. We're going to skip Part C. We'll come back to that in the next video. And today we're going to cover Medicare Part D. Now, Medicare Part D is your drug coverage. It's covered under a separate program. Medicare A and B have no drug coverage for anything outside of a medical facility. Everything else has to be gotten from a pharmacy, and your pharmacy coverage is under Medicare Part D. And here's how it works. Very similar to the insurance that you've had all your working life with an employer plan or an individual health plan. You pay a monthly premium, which might be $0 and up to $100 or more a month. The average this year is $34.50. That's kind of the nationwide average. They call that national average premium. And once you pay that premium, you're going to have a deductible, which might be $0, but could be as high as $615. That's this year in 2026. The maximum deductible is $615. And then after you've met your deductible, which might be $0, well, you'll just pay a copay when you go to the pharmacy. A lot of your generic drugs are going to be $0 copay if they are a tier 1 at a preferred retail pharmacy or mail order pharmacy. They're going to be $0. And your non-preferred prescriptions might be a couple of dollars, $3, $4, $5 a piece. But then when you get into the brand name drugs and the non-preferred brand names and the specialties, that's where they get really expensive. They can be $45, $100, or they even start becoming a percentage, say 25 or 35% or even 50% of the full retail cost of that drug. And it can be quite expensive. Now, one saving grace that Part D has in the last 2 years is a out-of-pocket cap, an out-of-pocket maximum. We used to have this thing called the donut hole. We don't need to worry about that anymore because that kind of went away. It's not as complicated as it used to be. Now it's just for 2026, a $2,100 out-of-pocket maximum. So once you've paid your $2,100 out-of-pocket for your prescription drugs at the pharmacy, now you're done paying. You don't pay another penny for your prescriptions until January 1st, it starts all over. Now, folks, this is going to work pretty similarly to what you're used to. The prices may be higher or lower than what you're used to, depending on the prescriptions that you are on. Quite often with generic drugs, you'll find that they're a little bit cheaper on Medicare Part D. And on brand name drugs, you might find that they're a little bit more expensive on Medicare Part D versus your former employer coverage. So it's a good idea to get some help with this, get a professional like we are here at Turning 65 Solutions, and we'll put them into this system and we'll analyze it and we'll show you what your actual out-of-pocket cost is going to be for the whole year. We'll put those side by side with your employer plan if you still have it, and with the private insurance, Medicare Part D. And then you just pick the one that makes the most sense to you. So that's what we do for you. Now, we have to review these plans every single year because these are 1-year contracts. They have 1-year contracts with Medicare, 1-year contracts with the pharmacies, and 1-year contracts with you. If any one of those 3 things changes, you might be without insurance or having to find a new pharmacy or a new prescription because the formularies can change as well. Everything about them can change. The premiums, the deductibles, the formularies, the copays, the pharmacy networks, everything can change. And you've got a one-time opportunity during the annual election period from October 15th to December 7th every year when you can get a new plan. And once that December 7th deadline passes, you're going to be stuck with whatever you've got for the upcoming year starting on January 1st. And I mean stuck. There's very few special opportunities to make a change to a Part D plan once that December 15th deadline passes. So it's very, very important that you review these every single year. It can literally save you thousands of dollars versus not reviewing it and the plan goes away or the plan changes drastically. And that's what we do, folks. Give us a call. The number is 830-217-6711, or look us up on the web at t65s.com. We've got a great website there with a lot of free information. You don't even need to put in your email address for most of it. Just give us a call. If you enjoyed this video, give us a thumbs up down below. That helps YouTube get this video out to other people who were seeking the same information that you were today. And be sure to hit that subscribe button so that you can be notified when we upload a new helpful video. The next one's going to be on Part C. That's where we take A, B, and D and combine them into one convenient plan. But there's some hazards that you need to watch out for, and I'll explain them in the next video. Until next time, folks, we hope you have a great day. Bye.